appreciate all of you joining us today para ibigay ang kanyang welcome message. May I call on the National Training Director and the Project Director of the National Sports Summit 2021, Mr. Mark Edward Velasco. Sir, magandang hapon po.
Yes, thank you so much, Joash. Magandang hapon sa ating participants. On our 21st edition or our 21st session, we will take a look at one of the most integral programs the Philippine Sports Commission has. Currently, it's called the Medical Scientific Athletic Services Unit, or the MSAS. And here to talk about a very dynamic and very capable medical consultant of the Philippine Sports Commission, Dr. Pai Villanueva. So I encourage all participants to listen carefully and enjoy and learn from Dr. Pai. Once again, magandang hapon and welcome.
Thank you very much, Sir Mark Velasco. And Sir Mark has been really supportive of our program for our very first session up to our session for this afternoon. But last but definitely not the least, to deliver his inspirational message on behalf of the PSC board, let us all welcome PSC Commissioner Charles Raymond Maxi. Com, magandang hapon po sa inyo.
Thank you, Joas. Good afternoon, everyone. Of course, we thank the participants for your time, for again making this National Sports Summit a very important event in your calendar. And this is, of course, a continuing education on through online platform because of the pandemic. But the Philippine Sports Commission, through the Philippine Sports Institute, is continually giving out programs, implementing programs that will benefit our participants through this online. And I hope you will learn something. When we talk of pandemic, we talk, of course, of health. So MSAS is very important component in your learning process. And of course, we have a top-notch speaker this afternoon in the person of Dr. Pai. So sit back and relax and have a fruitful afternoon of discussion through this online platform of the PSC. Thank you and good afternoon.
Maraming salamat po, PSC Commissioner Charles Raymond Maxi. Thank you, Com. And sabi ko nga kanina, today's session is one of the many lectures that we will be having for the first phase of the summit. Said earlier sa ating pong video, sports conversations would be presided over by recognized figures from the local to the international sports scene to deliver short lectures in the online conference format. And afterwards, an open forum will be facilitated to gather insights and views as a synthesis for every session. And para tulungan tayo doon, we have our moderator for this session. And ang ating pong moderator is an occupational health nurse sa ating pong Medical Scientific Athlete Services Unit ng PSC. And he was part of the medical services of our national athletes and syempre engaged din siya on sports coverages, bubble trainings, and participated sa Southeast Asian Games 2019 as a member of the medical team for Team Philippines. Let us all welcome our moderator, Mr. Danilo Ansay. Sir, magandang hapon.
Hello. Magandang hapon din sa inyo. Thank you, Joash. So, okay naman yung sound ko, di ba?
Yes, sir. Go ahead.
Okay. So, good afternoon. I'm here to present our speaker. Magle-lecture siya about sa MSAS. So, she is Dr. Pilar Elena Villanueva. She is current medical consultant for the PSC, Medical Scientific Athlete Services Unit. Dr. Villanueva is actively involved in the sports science program of the Philippine Sports Institute, from seminars about first aid in sports and other topics that encourages sports stakeholders to seek sports science and sports medicine enough to ensure the expansion of grassroots in sports. She is one of the founding members of the Sports Nutrition Association of the Philippines a fellow at the Philippine Academy of Family Physicians, and a visiting consultant at the Mary Johnston Hospital, Department of Family and Community Medicine, and in Healthway Medical. Dr. Villanueva is also a school physician at the University of Santo Tomas, has a residency in family medicine at the UST Hospital, and was part of the UST Faculty in Medicine and Surgery in 2005. So, Doktora, dyan ka na po.
Yes, here na, here
Hello, good
na.
afternoon, Doktora.
Good
So I
afternoon
give
sa
the floor
lahat.
for Dr. Pilar Elena Villanueva.
Hi. Okay na ba? Okay ba yung sound? No problem
Yes,
ba?
Doktora.
Ay, great.
Clear
Thank
na
you
clear.
so much. Thank you so much na medyo na-pressure ako sa lahat ng mga introduction. Thank you, Sir Mark. Thank you, Com Maxi. And thank you, Sir Dan. And thank you for the opportunity to be part of this wonderful program and also to talk about something very close to my heart, syempre the MSAS. I've been here for quite a while, and I've seen it grow talaga, and growing pa talaga siya despite the pandemic. So anyway, I will start sharing my slide na so I can share na more about this wonderful MSAS. So, ano ba tong MSAS? Actually, hindi siya masyado pang ganun kakilala. The name is quite new. It's important for us to know what it is, what it means. It's for medical and scientific athlete services. And from that alone, you can get a lot of what we do. We give medical services, we give athlete services, and all the services that we give has to be scientific. There has to be evidence. Hindi lang because it's popular, it's being pushed, it's in mainstream. We look at what is the best according to science for our athletes. That's why our mission is that for us to give the optimum level of care for Filipino athletes so that we can maximize their athletic performance through the use of sports science and sports medicine services and education. And aside from that, it is also our mission to assist in promoting physical fitness and sports participation among Filipinos of all ages, all abilities, so that we can encourage them to adopt healthy lifestyles so that they can lead useful, meaningful, and productive lives. And with that, we have a vision, or we have 4 visions actually. We want to develop and operate a state-of-the-art Philippine sports medicine facility and to provide innovative healthcare service so that we can create value for our elite or national athletes. And that's something we really are working on right now, as well as the MSAS specialization so that we can give more care for our athletes. We also play a role. We want to play a major role in recovery and pain relief efforts. Why is this important? It just shows how much we value our athletes. It's not just about winning medals. It's not just about getting there on the platform. It's also about taking really good care of our athletes. We listen to their pain. We listen to what they feel so that they can actually do more for us, for our country, and also live meaningful lives in the future. And our last vision, of course, is for us to be able to share the knowledge and the advanced techniques that we are able to learn or get through here, like seminars, scientific sessions, meetings, courses, and workshops. And with that, I want to show you our values. Superior service, we value care, proper care for athletes and employees. We value respect with our teammates. We respect teamwork. We value teamwork with open communication, and we also value dignity of our patients, of our employees, of our co-workers. And with that, we commit to this. Patient-centered focus for planning and care, supportive, inclusive, multidisciplinary team approach, respect for all roles in the multidisciplinary team, and tolerance of our differences. we all have our strengths, we all have our weaknesses, and we all work together to give the best treatment or service that we can. Then we also commit to open and clear communication among all team members, as well as to the different coaching staff, to the athletes, to our employees, any of our clients. We also commit to recognition of and respect for all team members' private lives, and mindfulness in delivering efficient and cost-effective services. So bottom line here is professionalism, teamwork, and of course, excellent service. Yun lang talaga ang aming commitment. So anyway, MSAS units, we have 9. We have medical, we have sports psychology, sports nutrition, sports rehabilitation, sports massage, strength and conditioning, performance specialist, sports physiology, and the doping control. So let's just take a look at these different units, what they do at MSAS during a daily task before the pandemic. So the medical unit, we'll tackle that first. It's made up of our medical consultants, made of your orthopedic surgeons and family medicine practitioners, and our staff nurses. All of them are now certified occupational health nurses, and we have 4 EMTs on board. So all of us are distributed in our 3 facilities in Baguio, in Pasig, and in Manila. So what do we do? Well, we have the usual consultations, we have the annual physical examinations, the vaccinations. Also, we do the pre-participation physical exam. Everyone, all athletes and coaches who are new to the training pool, who are going abroad, who are going to any event, they will undergo this. And this is done not just by our unit, but also by all the other units to ensure that everything is 100% okay with our athletes and coaches. So this would show, this is usually done a few days or weeks before the event, so that if anything is to be found, we can address it before the athlete or the coaches go on their competition or travel. So we also do medical coverage in local and international events and support to the athletes with the travel assistance and the travel medical kit bag. We also give educational programs, usually to the coaches, to the athletes themselves, to other sports-related professionals, and other sports medicine programs. So our next unit we'd like to talk about is the sports psychology unit. This is headed by Dr. Karen Trinidad, and they have 4 sports psychologists and 3 registered psychometricians on board. And their aim is for the unit to help the national athletes and the coaches to recognize the need to study their sport and master the mental elements of the game. Because by doing this, they're able to facilitate the use of the psychological principles to develop abilities to manage their emotions, yung resiliency nila, maintain focus and concentration, and be able to deliver sustained performance even under extreme pressure or circumstances. So these are their basic services, and we'll go through them one by one. Psychological evaluation and feedback, where they're able to assess the capabilities and future manifestations of the athletes. They are able to assess the mental preparedness using some interview and tests, and this usually lasts for 20 minutes. The next service is counseling therapy to address emotional distractions by the athletes so that they can develop or improve their coping skills, so that they will be able to address these distractions, so that they can focus more on their training. This usually lasts about 30 minutes to about an hour, but it's just not standalone. It's recommended that this be done over several sessions because it's going to be an ongoing process. So the next is the competition assistance done pre-game, on the on-site coverage, and post-game debriefing. The pre-game talk is important. It's done a day before the athlete's competition. This is used to help manage the expectations, help in building their confidence, help with dealing with any pressure they are feeling, so that they will be able to go to bed with a good mind frame and wake up with a good mind frame. And on site, they will reinforce this so that they will be ready mentally for the competition. And it doesn't stop there during the competition. For the on-site coverage, they really watch how the athlete goes through each game, and then they watch how they react. They watch their competitors, and then this is something they would discuss as well during the post-game debriefing. So win or lose, they will have the post-game debriefing. It's usually done right after the competition or even a day after if the athlete is not that ready or comfortable yet, maybe a bit tired. So they can do it a day after to process whatever happened before. They can learn from whatever happened during the competition and redirect to a new set of goals. Next service is a sports-specific psychological skills training. So it focuses on psychological qualities or attributes that need to be developed specifically for a certain sport. So is it focus? Is it imagery? Is it improved confidence? It depends on the sport. So there's an assessment, there's a talk, and then there's the workshop where they can do or work on this psychological qualities or attributes. And this usually lasts for about 1 to 2 hours. So the next is the lecture for coaches. They're very open and encourage coaches to learn more about psychological principles because this will help in their coaching relationships and give them more new strategies for better coaching. And they also offer team building activities so that each team can align around goals. They can build effective working relationships. They can be more active in finding solutions to team problems and reduce ambiguity in their roles in the team. This can be done half a day or the whole day. It depends on the set activities. So the next unit is the sports nutrition unit, headed by Ma'am Karen Pineda with her nutritionist, Ms. Mary Jane Serapion and Ashley Villa. And included in their duties and responsibilities is to provide nutrition counseling that is appropriate for the athlete before, during, and after training and the competition. So there are different types of nutrition principles being implemented here because there are different needs during this time, before, during, after training, before, during, and after competition. So this is how they do it, usually in teams here, or they can do it individually as well. This is also part of the pre-participation physical exam. As I said before, it's before they go out to an event, or it's for incoming athletes in the training pool or coaches. Included in their duties and responsibilities is the provision of cycle menu for sports team. The cycle menu is a set menu they make for a certain number of days, maybe a week, so that it can ensure that the athlete is getting the proper nutrients and they don't really have to think so much about what to buy or what to cook for their next meal. And also so that they won't get too tired or too bored of the usual food that they eat. So you can see, this is what it's usually being prepared in the cafeteria, athletes' cafeteria. They also give lectures to athletes, employees, to schools or universities, LGUs, and other organizations on sports-related sports nutrition related topics such as Paralympic nutrition. You have vitamins and minerals, hydration, making a periodized menu. We also assist in international sports events so that our athletes are able to eat the proper diet. They monitor everything. They buy their snacks. They go to the hotels to check their food. They go to the events to make sure they have received and are eating their post-competition or post-event snacks. So they provide nutrition counseling also to our employees, and they also perform other functions being assigned to them, as well as supervise the athletes' criteria. This is a picture of one of the menus they develop in the athletes' cafeteria, and see how happy they are, see how wonderful the food they have every day. Very nutritious, very filling, and definitely the athletes won't get bored with this. So they also provide nutrition periodization. So this is a strategy wherein, you know, they make a nutritional plan according to the to the training period of the athlete, and this is done in coordination with the strength and conditioning, with psychology, with medical, with the other units as well, so that there are certain foods or certain calories that are to be given at a certain time or a certain day according to what activity the athlete is going to have or is set to have on that particular day. We also conduct dietary supplement review so that supplements can be regulated if they really do need them or not, and give advice on this, as well as for doping purposes. So next unit is the sports rehabilitation unit. We have 10 physical therapists, and they usually have three shift duties in our 3 clinics in Baguio, in Manila, and in Pasig. And here they see the athletes during their training. Some of them are post-operation, some are there after competition, before competition. All of them are treated accordingly to what they need. And they also are there for just about every event the PSC has, like the weekly Larot Saya, weekend sports events, regional sports events, international sports events, and sports-specific requested services, because this very hands-on na unit. Of course, it's physical therapy, it's sports rehabilitation. They have to be physically there to be with their patients or their clients. They also give talks at sports summits as well. All of the units actually, and it's because it's one of our vision to share what we know, to share our experiences. So anyway, our next, here's of them, a picture of them on their team-specific duties. Next would be our sports massage unit, made up of our 12 masseuse, also distributed among our facilities. So their basic duties would be your pre-event massage, inter-event massage, post-event massage, but they're not limited to that, because they also are there during the training periods. They also give seminars and workshops. So the thing about the pre-event, inter-event, and post-event massage is that they know exactly what is needed by the patient. There are different techniques that they have studied, they have mastered, and they implement. So it's not just fully hand massage. There are different techniques. They use different modalities to give service to the patient. For our performance specialist unit, they are there to track the performance of the athlete and to audit the training program. And so they need to get data. They do physiological testing and evaluation. They analyze the data and then they communicate the results to the other units as well as to the team itself. Okay, this is what they do. They have a lot of paraphernalia as well. If you see them, They do a lot of measurements, a lot of modalities to get all those necessary data. The sports physiology unit is a bit related to them because they also do physiological testing and evaluation. They also gather the data, but the data they gather, they compare to previous PFT results, to norms of Filipino athletes, to data from other international elite athletes, and they evaluate this, they analyze the data, and they give further recommendations for training based on the test results. So whatever they recommend, again, like all of us, they use scientific updates and evidences to give appropriate recommendations. And they give feedback to motivate yung athletes and the team on how to push themselves or strive harder for improvements. This again is done in cooperation with the other units. We also do aid in screening for potential athletes. That's known as talent identification. So if you see them going around during the events, they are doing talent identification. They're doing a lot of measurements, again, based on scientific evidence, based on scientific updates. So this is what an example is of what they do. First, they talk to the team, they do some measurements or activities, and then once they have all the data, they discuss it with the team. Then we have the strength and conditioning unit headed by Coach Mark Doniel Bayang. So he gives sports-specific programs as well as individualized programs in preparation for their events. It's not just, it has to be specific, right? So he really works on each sport, each athlete's, their needs as well. And he shares them, his insights, his knowledge through seminars and workshops. And last but not the least, we have our doping unit, or also known as the FINADO, headed by Dr. Alejandro Pineda Jr., with his doping control officers, Justin De La Cruz and Alethea May Laquindano. So aside from the expected doping control coverage in local and international events, they do training programs, they do a lot of seminars, and they do a lot of information campaigns. And it's very important, they're really pushing hard on the information campaign because even now, a lot of, especially now pala, there's a lot of products coming in, a lot of people selling, a lot of companies selling. It's very important for us, or for everyone, for athletes, for others, to know more about doping, to know more about substance use, and how this affects sports play. So what about now? That was what we did, but then now we have this pandemic, but our work goes on. So aside from our usual activities, we have to adjust a bit. That's the present right now, what we're doing. We have our on-site clinic still in the 3 facilities, but we do have mga stringent protocols like screening first, and then PPE in the area, monitoring activities. The one here is in Baguio in the lower picture. So we also do health monitoring, and we also assisted during this COVID pandemic, monitoring, contact tracing, support. We also assisted, here on your left is Dr. Occidental in Baguio, set to assist all the athletes on their way home to their provinces. Then here on the other side, you can see they're sterilizing the clinics and the other units, as well as the dorms actually. They sterilize that. Our ambulance is being used regularly to pick up those who are positive and take them to quarantine facilities. And look, as you can see, it's being regularly sterilized as well. So we still do our teleconsultation. Actually, we do it much more than before. And the good thing about this is there's no limitation to clinic hours. We do it 7 days a week, whenever we can, any hour that you need us, as long as you go through the proper channels. We give webinars and we attend webinars. As I said earlier, our nurses already underwent training for occupational safety. And so they're all certificate holders of that. Then we also do health monitoring in the training bubbles and ocular visits to training bubble venues to ensure that health protocols are being maintained. So for the sports psychology unit, they're really banking or using a lot of the internet. They use telepsychology, and also teleconsultation. We don't really have pictures here because, of course, of confidentiality, but those are very active areas in sports psychology unit right now. And they also do mga webinars and lectures as well. For the sports nutrition unit, they also do webinars and have Zoom meetings with different national teams to allow nutritional assessment, nutritional consultation or counseling, and some team lectures about nutrition and other related topics. So they also are very social media savvy. They have a lot of posts on their sites. You can see them, you can check out their site. And the next unit is the sports rehabilitation unit. And they also offer tele-rehab. And here are the steps. This is accessible for national athletes and coaches. They also give webinars such as this one, quick interventions for common injuries. Once the bubble opened, they were able to do face-to-face treatment, but they also had very strict rules. Pure scheduled treatment, use of PPE, sterilization of the area, discouraging the use of the gym and contamination there. They have to have a dedicated treatment area or room, and all of this should be strictly enforced in all bubble environment. For the sports massage unit, surprisingly, they also do virtual consult. And they also do a lot, they did a lot actually of lectures like DIY sports massage, personal massage techniques with the Philippine National Soft Tennis Team, and massage techniques using simple tools with the National Petanque Team. And they also gave lectures for the coaching certification online course. Once the event started, they also went with them in the bubble, or in the event itself, like the Asian Elite Boxing Championships and the surfing qualifying tournament. Again, they also follow very strict protocols when they do their face-to-face accommodations. They have to be scheduled one day before. Disinfection has to be done strictly before and after every client. They advise the athlete to shower first before treatment, bring their own towels, and whatever they use during the treatment period, they change immediately. For the sports physiology unit, as they are monitoring and assessing, they're using a lot of teleconferencing as well. Same goes for the sports performance unit. You can see here on the right side how they were able to track an athlete over several days. And as you can see on the left side, they do this in cooperation with other units as well. Strength and conditioning also really did a lot of teleconsultation, which is quite a challenge because it's a different environment. The challenge of equipment isn't there, but slowly our coach is helping the athletes go beyond the limitations and do with what they have. And the doping unit is very active right now in education, in awareness. If you would check their website, every now and then they would have posts on a webinar or some information for us. So in sum, I'd like to remind you of this. Do you remember here, PAMI, of course, as Sir Ramon Susar said, it represents every nation, every athlete, every person coming together to support each other at the games. And with that in mind, I also made our own mascot, Pinsan ni PAMI, si MSAS, to represent every unit, every MSAS personnel, every person coming together that support every Filipino athlete. So almost done na tayo. Let's have a bonus trip. Let's go on a virtual tour to check where are we now and where are we heading. So we're going to our 3 facilities, to Baguio, Manila, and Pasig. So first stop, sakay tayo sa ambulance nating very new, very clean, very sterilized teachers camp in Baguio City. As you can see, we have a new clinic there, a new structure. Actually, lahat ng clinics, even during the pandemic, during the pandemic, ginagawa pa siya, ni-renovate, inaayos pa siya. So it didn't really stop. Medyo nag-slow down a bit, but we're getting there because, again, we have a mission and we have a vision. So here in Teachers Camp, Baguio City, we have our clinic and gym on the first floor, rehab and massage on the second floor. And in Manila naman, you see there the Rizal Memorial Coliseum. It's very breathtaking, especially at night. So dapat yung MSAS should also be as beautiful. So it's still undergoing a renovation. But again, as I said, we are getting there. So we have our dental clinic there, our consultation rooms, our gym, massage room, and later on, the other rooms as well will be fully renovated. And last stop, of course, in Pasig City, at the Spill Sports Arena. Syempre, hindi papatalo ang MSAS. It's going to be our headquarters. It's really big, 3 floors. We have our clinic, our consultation rooms, and first ever, our operating room here. We have isolation rooms. We have a laboratory and an X-ray room there, all ready to be used. Siguro when we're ready to have face-to-face na. We have all our other rooms, the psych, the Fisher room, strength and conditioning, rehab room, the massage. One is for the regular athletes, one is for the para athletes. See how wonderful this building is, how we're trying to give the best or give more to our athletes. And lastly, our gym there in Ultra. So anyway, we're done with the lecture, but I would like to end with these parting words from Antoine de Saint-Exupéry. As for your future, your task is not to foresee it, but to enable it, right? It's for us, it's for all. And meron ding parting words from our chairman, life is short, live it well, make it significant. And parting words from me, thank you for listening. Thank you po.
Yan. Hello. Thank you po, Doktora, for very insightful lectures regarding the MSAS. So, I'm just here to recap kung ano po yung lecture ni Doktora po kanina. So, MSAS is a group of specialists that provides and renders services for athletes and coaches. MSAS not only provides medical services, but rather provide all that is necessary for our athletes and coaches to improve and to better perform in their everyday life. MSAS have different units. Nabanggit na dito ko kanina, yung medical, sports psychology, sports nutrition, and etc. All of these units work as a team to provide and accommodate all the concerns of our national athletes and coaches, not only with their competitions, but also with their pre- and post-competitions. Gaya na banggit ni Doktora kanina, we also conduct workshops, seminars, meetings para ma-share yung knowledge and mga every advances and techniques in the field of sports and sports medicine. So in this time of COVID-19 pandemic, we in MSAS were able to respond and adjust by working and coordinating with the NSA, coaches and athletes, as MSAS is always looking forward to the fulfillment of its vision in the future. Okay? Thank you po, Sir Joash.
There you go. Maraming salamat po to our moderator. And syempre, very, very insightful. Sobrang malaman nun. And I hope everyone is getting yung mga information na sinishare sa atin ng ating speaker, si Doc Pai Villanueva. And thank you very much, Doc. And that being said, ako din may gusto ko po akong i-add a few, Doc, if you would let me. Nakakatuwa lang yung glimpse na siguro a part of the recap na lang din. Siguro I'd like to share something. Ang ganda po nung lecture that na-share sa atin kasi it really gave us a glimpse of the MSAS, yung past task from pre-pandemic to the present to the pandemic time, and yung future, yung post-pandemic. And alam po natin that even us inside the agency, no, I think Doc would agree with me on this, na we are very, very challenged on different units, especially sa ating medical unit, ano. And it's great to see na how we have progressed from our past task to the present task with the pandemic, and how we will be able to cope in our future alive question. Go ahead, Sir Daniel.
Okay. Dr. Pai, question number 1. Can the public avail of your services to benefit our grassroots athletes or coaches in the provinces?
Alright. Yung mga actually may program naman talaga. All you have to do is request from the office and gagawa ng arrangements for it. Kung what specifically, the specifics we need, and syempre the time, date, and the venue. Yun, makikipag-usap lang. Very open kami dyan.
Okay,
And
Dra.
saka lang additional. Right now nga, even during the pandemic, meron mga nagiging online webinars from different LGUs. Nagbibigay naman kami.
Okay, so question number 2, Dra. So, did the MSAS also assisted or service the Tokyo Olympians and the Paralympians?
Oh, ongoing naman. They're always in contact. Syempre, we're in cooperation with Olympic Committee, POC, and we also take care of our athletes. Our services are open to them. They are in contact with us. Yun lang. Lahat naman ng national athletes are also under our care.
So, Doctor, another one is, are you the same unit as the PCSM? This was the familiar unit to me from way back.
Yes, yan, way back. So, ni-revamp tayo, ginawa tayong medical, scientific athlete services because you want, the scientific part to be there as well. So yun nga. And now, we have our mission, we have our vision, yung state-of-the-art facilities. You have scientific information. Yung mga yun yung mga guiding mission, vision, values natin.
Hello, Dra. Kasama
Yes.
ko ng PCSM days na yun, no?
Dito na nga pumuti yung buhok ko. Dati blonde ako.
So, Doctor, another question. How are you, PSC MSAS, able to adjust to the new normal? What are the challenges and how did you overcome this?
Okay, sa new normal, yun nga, we have to rely a lot on teleconsult, which is actually good nga, sabi ko, for the medical part. One of the good thing about the teleconsult is that we are not hampered by yung clinic hours. So anytime they need us, kukontakin kami directly or yung nurses, and then we respond when we can. What else? Yun lang. We can't really do physical examinations when we have a patient. Wala rin nga yung annual physical exam. We can't give medicines na syempre hindi ko naman maabot through the screen. Sayang, kawawa din yung patient. And we can't really assess. Yun ang limitation. Hard to assess. And I guess it's harder for the more physical units like sports rehab, massage units, strength and conditioning. But they're doing the best using the modalities. Ang maganda rin kasi dito, they already know a lot of our athletes and teams. So, mag-cooperate, we work with, hindi naman tayo very strict, medyo flexible din naman tayo, and we work with what we have as long as, we have a goal, kunyari sa strength and conditioning. We are very specific with our goals, what we want, and let's see what we can do about it. We have materials like this, and then we'll use the materials like that. But this is what I want you to do. For the medical part, it's the same thing. You have to be more communicative. You have to be more informative from what you want from the patient. And anytime they can communicate with you. Yun lang. Pero another challenge, of course, is the COVID, which is a different story. course. But we're doing the best we can. We have our own protocols, we have our own monitoring. And again, yung maganda is we can communicate anywhere as long as you have access to internet. But also, we use din yung mga telephone talaga because some have poor Wi-Fi connections. But again, we're doing the best that we can.
Okay, add ko lang din yun nga yung teleconsult, meron din kaming phone consult. In some cases, merong via text lang kasi nga mahirap may signal, di ba?
The signal kasi, yes.
So, another question from Biscast Miss Diane Torres. Do the programs of MSAS presented today available in the regional PSC offices, and who are they catering to?
What do you mean regional?
Regional.
Well, it depends by ano kasi yan coordination, like let's say sa Baguio, hindi lahat nakastay in, right? But they coordinate their needs for anything like psychology. They schedule it, gagawa ng paraan yan. Pero again, it's easier to access that, yung mga nutrition, yung psychology, because again of communication capabilities. Yun lang din. Again, very open naman kami to share our resources as long as you let us know. And then, we can talk about it. Siyempre, hindi ako. Yung mga katas-taasan ng bahala dyan.
Yeah. Follow up ko lang kay Doktora. So, as regarding sa regional offices, pag mga national athletes naman natin, so, pwede naman siya i-cater as long as makipag-coordinate sila sa mga nurses natin doon. So, next question from SK Bulusan, John Furio. Does MSAS envisions to build stations at least on each regions?
Station. Nako.
Good question.
Good question. Pero hindi ako nasa position to answer that. But that is a good idea or good dream. Actually, gusto ko nga yun na to be able to reach out to more and more people. Kasi remember, our second mission is to encourage the Filipinos in general to have a more healthy lifestyle through sports. And that's one of the ways to do it. Another way is to use social media, of course, but building that infrastructure, it takes a lot of planning, it takes a lot of this, but it's a good dream. And we can dream, di ba? We can enable, syempre, one step at a time.
Meron dito medyo general yung question niya.
Okay.
What could be your advice to everyone who is experiencing depression and anxiety at this time?
Oh yeah. Actually, kaya nga maraming hotlines na available. Maraming nilabas sa National Mental Health Institute ba yun? Ang POH, maraming universities ang nag-open ng hotlines, even mga NGOs, because that's a very serious matter right now. It's very important to talk it out first. Tingnan mo muna kung saan ang accessible sa inyo. Like, kunyari, as I said, I am a school physician. So, we have access to psychologists and counseling. Pero, syempre, kakausapin muna namin din yung patient. Pero, for some, yun lang ang problem. Titingnan nyo if you have access at work, if you have access in other ways. Pero yun nga, take a look at maraming naglabas ng hotlines ngayon. We can talk about it if you want. So may sinare rin ako ng listahan before about that. Or it's easy to search then.
Yes. So peer groups and family dapat kausapin.
Yes.
So
Lahat.
lahat. So,
Actually. Pero mahirap pag isolated ka at walang wifi.
So, another question, SDO Bilaran, sorry. Maria Socorro Sambitan. With regards to talent identification, what is the new system or practice in the screening of athletes with potentials since there are no meets or sports competition held so far?
Okay, so yun ang magiging big problem. Actually, a lot of our activities have to take a back seat kasi we are adjusting. Even right now, wala nga akong physical exam. So, magfo-focus muna sila, I suppose, on our athletes right now. Pero I suppose they're also in contact with possibilities. Although I can't really speak for our units themselves, but then we'll see. Yun, I'm thinking that because of the pandemic, it's a bit medyo low siya in terms of priorities.
So another question from Karsu by Mr. Mark Joy Credo. Can MSAS share physiological and psychological tests of athletes to the public?
Oh, yan, I can't really answer because a lot of them are proprietary. Sorry. And they purchase it, but they'll share their knowledge and what they can if you contact them and siguro set up a lecture or a workshop or a webinar with them.
Okay. Question again, Dra. Anong current situation ng doping sa Pilipinas? And gaano kahigpit ang MSAS sa cases ng doping intrigues, mga intriga?
Oh, okay. Siyempre, hindi tayo mag-i-indulge sa intrigues, right? Let's respect the athletes. Let's respect other people. Medyo focus na lang tayo sa buhay-buhay natin and our own task. Pero as for the doping, syempre it's still there. It's a very important part, especially now we're heading into the Olympics. It's actually very important every day in the everyday life. Kaya nga in the pre-participation physical exam, they're also taking part there to give counseling before they leave yung for any event. And of course, very active again, as I said, sa education and information. Kasi doon tayo nadadali eh. Kasi masyado tayong bombarded with all these products and they say it's safe, but we can't really be sure. That's why they're doing their best to be very accessible and to educate, inform, and let our athletes and our other people know more about this. Not just the athletes, the coaching staff, the parents. Minsan kasi nabubuyo lang ng kapitbahay, uy, gawin yun. Take mo to, right? Pero it's partly, not just doping, it's also partly psychological. It's confidence in yourself, partly strength and conditioning because I know what I'm doing, your nutrition. Mas maganda na lang sila, invest in their nutrition, invest in their training, invest in their psychological health rather than in, not okay substances.
Ako po, Doc Pai, meron po akong isisingit na question. Baka
Yes.
may mga participants po tayo, I believe, that are new to our summit. Some of them have just entered po our batch 6. And baka po, can you share with us ano po yung mga responses na ginawa ng MSAS to the pandemic time? I believe Doc Molo from our very first session mentioned about Filipino First, yung program about how yung program that was created by the PSC, yung our response to COVID, or can you just share any of our experiences po? How did we deal sa pandemic time? Pasimula pa lang up until now.
Well, pandemic time kasi marami talagang preparations. Araw-araw yata nag-meeting sila Doc Molo tungkol dyan sa pandemic and how we're going to respond to that, right? So a lot of it, well, syempre we want to take care of the health, medical wise, of the employees, of the athletes, and of course to continue with their training as well. So we had to make provisions on how we're going to do this. Kaya continuous pa rin ang ating services. We are adjusting to our services, but still we are there for everyone, of course. But we also, we're very active in the COVID response, right? We monitor as well everyone that's coming in and out of the facilities. Nangungumusta kami sa mga athletes, they come to us. Actually, sila mismo ang ang lumalapit sa amin. Ito, out of the blue, meron na lang magsasabi na, Doc, COVID positive ako, help us, ganon. And then we try to do what we can with what we have, of course.
We have, I think we have
Painom muna.
Sige po, Doc, go ahead. Habang nag-take ng very short break si Doc, kung gusto niyo pong tanong ng ask on live question, you can always raise your hand and we'll be very happy to accommodate you right now if you want to ask a live question. And yeah, available po ang ating reaction buttons here. And nakakatuwa lang po, no, Doc, dahil yung medical field has been really challenged all throughout, but we have shown our different ways to find paano natin mapilit. Yeah, we have question. I have question po from Romeo Alejandro Delgado. Does MSAS provide assessment for special athletes? I think yung mga para-athletes po.
Yes, we do.
Such as psychological eye test and others. Doc?
Actually, hindi ko na sila differentiate because I take them as part of, our community. Wala na masyadong distinction. Of course, syempre, iba yung events nila and capabilities, but they are part of our clients. We cater to them in the same way as we cater to others. Pero yung mga special tests, siguro pag open na yung bagong facilities natin. Medyo may limitations pa. Kasi before the start of the pandemic, doon na nagsa-start yung mga remodeling of the structures. But after that, siguro magkaka-improvements. And if you take note, before the pandemic, a few years mula noon, medyo nag-start na rin yung talagang na-recognize ng mga para-athletes natin, women athletes. So that's really something I'm into talaga. Itong mga, I'm really rooting for them. Yun lang, sabi ko.
So I have a question po. Doktora,
Yes.
may mga nutritional programs po ba tayo para sa mga young athletes natin na medyo natigilan sa kanilang sports due to pandemic? So hindi na sila masyado nakapag-train for now.
Oh, okay. Well, it's it's always available. All they have to do is ask. Yun nga, as I showed earlier, very active sila in conducting counseling, in webinars and lectures. Very open sila. Actually, ang sipag-sipag nila sa mga ganyan. Because, well, it's a calling for them. And yan, that's something that it's really magagawan ng paraan.
All right. I think this would be our last question. Sabi ni Antonio Tolentino III. Doc, I would like to give you din po parang insight niyo po on this question. For you po, how important is the medical support for young athletes in the basic education? Who would be responsible for introducing medical support? Because we all know that it is very rare for DepEd to have medical personnel in schools. I think this goes beyond collaboration, Doc. Ano pong...
Okay, yan. Actually, it's a very important question to me kasi yun nga, I'm in school health, pero I'm in a private university. Pero yun nga iniisip ko, bakit hindi na PPE ang mga young athletes? At bakit hindi nag-guide masyado ang mga young athletes? But yung naisip ko, it's a process for one, but we are reaching out, diba? We have our grassroots program. We are lecturing to the coaches. Kasi, I know, limited yung health personnel ng DepEd. Pero by reaching out first to the coaches, kasi sila naman yung talagang first contact ng mga athletes na to. Sila ang frequent contact ng mga athletes na to. And they know na what's new. Kasi baka mamaya yung iba, yung mga old beliefs and old techniques or mga ginagawa ang ini-employ. And nakita namin yan through the lecture, parang nagbabago ang mindset, na-open ang mind. And doon magsisimula actually yung changes and guidance na pwedeng maibigay sa mga young athletes nito. Pero ideally nga, sana meron ng mga medical personnel to do all that stuff. Pero let's say the coach knows about PPE, ng mga athlete ko, parang kailangan ma-check up. Ang gagawa ng paraan, school, baka pwede naman gawa natin ng budget para ma-physical exam ang mga bata, di ba? Or baka pwede naman mag-set tayo ng date para mag-invite ng nutritionist para turuan tayo. Mga ganung bagay. We don't have to be limited with what we have, pero, just open it up. Open our avenues.
Also, it calls for an opportunity to collaborate din, Doc, no, with different agencies. Siyempre, right now, we have mga local sports executives here. May mga sports educators tayo na naka-on yung cameras and tumatango sila with everything that you say, Doc. And I think also that really calls for a collaboration. And I believe, Doc, yung MSAS is very open to collaborate with everyone.
Yes, of course. Always.
All right. Maraming salamat po to our guest speaker, Dr. Pavilin Weba, and also to our moderator, Nurse Daniel Ansay. Very, very cohesive open forum and synthesis. And I know we are bound by time restrictions, but we know here, marami pa po kayong katanungan, still a lot of questions to be answered to. And ang MSAS is always, I think, ang MSAS always available sa ating mga social media accounts on the PSC and different units as well. Meron yan, so you can reach them and also Doc Pavilin Weba. And as I said earlier, lahat po ng mga questions that will not be answered, all of it will be turned over to our data processing and wala pong data that will be wasted. Everything will be turned over to our research. And we will now take this time to honor and award the Certificate of Appreciation sa ating pong 21st speaker for Sports Conversations 2021. And to award the certificate, may I call again our Project Director, Sir Mark Velasco, to award the Certificate of Appreciation. Sir?
Yes, Joash. Well, thank you so much sa lahat ng nag-attend, no, and listened and asked questions. So, on behalf of the PSC, we'd like to award the Certificate of Appreciation to Dr. Pilar Villanueva for her invaluable contribution as a resource speaker for the Understanding the MSAS part session of Sports Conversation, the first phase of the National Sports Summit. Signed, William Ramirez, 14th day of July, 2021. Thank you so much, Dr. Pai.
Thank you, Sir Mark.